Well, a warm welcome to today's update as always. Now, this is a bit of a global update. We're mostly focusing on the United States today for this Sunday update, and I think it's the 2nd of August already. Interesting things coming out of the States. There's discrepancies now in the way that data is being reported, and we'll look at that in a little more detail. But basically, if we look at the countries where cases are highest, that's the United States, Brazil, Russia, India and South Africa. According to official data sets, the only places where the number of cases is accelerating is in India. So the United States, Brazil, Russia and South Africa, according to the official data at the moment, all have a high number of cases, but the number of new daily cases is actually decreasing in those areas. And we'll have a look at that and see what we think. Now, this is the global situation here. Official cases, official deaths. And this is the World Health Organization website. So let's have a quick look at that now. This is the World Health Organization website. Now, these numbers have just been updated. They were showing numbers that just really didn't make sense just about half an hour ago, but they seem to have got their act together on the website now. So that's encouraging. Even so, these numbers are a little out of date compared to other data we'll be looking at later, which is surprising. You would expect the World Health Organization to have the latest figures, but they're not a long way out. Then on the World Health Organization, you can click onto this World Dashboard. And this is quite fascinating because it's one of these live time ones. And, well, reasonably live time, very short delay. And, okay, it's all official figures, but you can go to any country of interest around the world. Cases increasing in Eastern Australia at the moment. That's a bit of a concern. But you can go anywhere around the world and look at what's happening. And it's all colour-coded for you there. Trouble is, once you get onto this, it's quite hard to get away because there's an awful lot of very interesting data there. But the link's there. Do click in it and have a look. I'll just show you what I meant before we go on about these numbers, these official numbers. Now, this is the new daily confirmed cases. So it's the new number of cases confirmed every day. And we see in the United States the numbers are going down. India is going up. Brazil leveled off and going down. South Africa going down, and Russia's got a constant downward trajectory on that. So that's the new number of daily confirmed cases, and I'm using the linear scale. But then if we look at the figures per capita, which I think is always useful to do, we get a similar situation. So we see that South Africa, the United States and Brazil are all kind of in similar areas really for per capita new cases. But we see that in Brazil, the per capita new cases are going down. In South Africa, they're going down. In the United States, they're level and going down. Russia, they're going down. But India, they're going up. Now, this is all based on official data. And it's not all accurate. So it's getting... I'll give you some examples of this as we go through. But I've had a bit of a frustrating time this morning. It's getting more and more difficult to be able to adjudicate what is the most accurate data. It's getting more difficult, but you'll see that as we go through. So anyway, let's carry on with the United States. This is the latest figures for the United States. This is from the Centre for Disease Control figures. Over 4.5 million cases. Now, this is from the New York Times, which has got a new database which I'll be pointing out shortly. Average new cases per day over the past week has been 62,579. Now, this has just so happened to be going down or to have levelled off at the same time the way that the data was gathered in the United States changed. Now, it could well be the case. It could just be a coincidence. It could just be a coincidence. Because we had expected these numbers to carry on rising. That was where the trajectories were, but when the data method was changed, the numbers levelled off and are now going down, which of course is good to see. Let's hope it was just a coincidence. So the new cases, this is the number of new cases, so this is the rate of acceleration is now down 5% from 2 weeks ago. So that number of new cases is 5% less than a fortnight ago, which is encouraging, of course. Deaths still increasing by around about 1,000 or over 1,000 per day in the United States. And that website there is giving the live RT figure. And I've looked at it, but if it is, I'm not going to go on to it now, but if it is accurate, then it's showing a decrease in the rate of acceleration in the United States. Now, of course, this still means that the total number of cases is increasing. But according to this data, the rate of decrease is down. So there's more and more cases coming, but the rate of acceleration is less than it was, 5% less than a fortnight ago, which of course is encouraging, if that data is accurate. Now, Florida. People in the southern United States have had a rough time. There was hurricanes in Texas recently. Now it's Florida's turn. State of emergency, shelters prepared because of the hurricane. People advised to have 7 days supplies of food and medicines in the house. And this is real bad timing, of course. Outdoor testing suspended. We're just desperate for testing in Florida and California at the moment, but in Florida at least it's suspended. Now, the problem is that this hurricane, the strength of it is actually, I've just watched the news on it this morning, the strength on it's actually decreased slightly, but apparently when it goes over warmer water it could increase again. And it's scheduled to go right up the East Coast, heading for sort of New York, Boston, so could be a potential problem. 70 million people are at risk, and it really is very unfortunate timing. There's been a lot of unfortunate timing this year in the world, it has to be said, from locusts to hurricanes. Now, let me give you an example of what I was talking about. California. Now, I just checked this literally half an hour ago. California, the Centre for Disease Control give that number, and this is, I've just literally just checked this, but the New York Times database is showing well over 500,000. So, okay, the difference is what? The difference is 16. The difference is 16, isn't it? It's not a massive difference, 16,000. But what concerns me is that the gap between this figure and this figure, if that disparity goes on growing, then it's going to make the CDC figure look more and more inaccurate. So we're left with this problem, which is more accurate? The New York Times figure from a newspaper, will be a newspaper that does research, or the National Institute for the Centre for Disease Control. So we have two figures. And to me, the New York Times is gathering its information directly from state and local health agencies and local hospitals. So it looks to me like the data from the New York Times is more accurate than the data from the Centre for Disease Control. Now, if that's the case, and it appears to be the case, and especially if that discrepancy carries on growing, as it looked like it's going to, because we've got two different methods of data gathering now in the United States, we're going to be in a situation where the data from the CDC is looking more and more farcical. And that is, to me, that's just nothing short of a disgrace. If the US Centre for Disease Control is giving out inaccurate data, what are we supposed to hang our hat on, really? Really, it really is too much. And I found it frustrating this morning, but this is the kind of conclusion I've come to. So my considered opinion at the moment is the New York Times data is likely to be more reliable because it's collecting it locally and collating it all together. So that's just that example from California. So have we got more than 500,000 cases in California? Yeah, I think we probably have. Is that shown in the data from the Centre for Disease Control? Well, no, it's not. Don't take my word for it. That's the New York Times database there. Browse away. It's absolutely full of fascinating information. It's one of these sites, though, if you do go onto it, you might be stuck for ages because there is just so much interesting things to consider there. Now, the disgrace of the Georgia summer camp. Now, the irony here is that this summer camp posted a video saying how clean and how well done everything was on the 11th of June. And they were there cleaning surfaces and making a bit of a fuss. So they actually posted this publicity video, which seemed to be saying, our camp's nice and clean, come to our camp. But anyway, let's stick to the data. As far as I know, the camp closed round about the 2nd of July. Not quite sure about that, round about that date. Now, so the 11th of June to the sort of 2nd of July time period, I think we're talking about here. 597 attended. 344 tested. Now, of course, this immediately raises the question is, we could do a sum, 344 take away from 597. That leaves us quite a big number. Why weren't they all tested? So query where the missing testing is there. Presumably they know who these young people are. Why haven't they been tested? But of the ones they tested, 260 were positive. So the assumption is that these 206 positives, and who knows how many more extra ones that weren't tested, that these cases were, the assumption is these cases were contracted at this summer camp after they posted this, what now appears to be presumptuous video. And the camp authorities themselves are saying they wish they hadn't reopened now. Well, really, I mean, you know, we've been flagging out the dangers of this back since March or February, and you have the authorities for this camp authorities on the 11th of June didn't seem to realise. I mean, really, what planet have these people been on? I mean, personally, I'm involved in a summer camp, or have been involved for about 19 out of the past 20 years in a summer camp for young people in Cumbria Christian Youth Camp, and we cancelled it back in ages ago. You know, we just, there was a brief meeting, I was consulted, other information was taken, and it was decided, it would have been on this week actually, it would have been finishing, would have finished yesterday actually, but the camp was cancelled months ahead of time, just looking at basic data, but for some reason these ones in Georgia didn't seem to manage that. Now, what can we learn, given that this has happened, what were the drivers? Because we always need to look at the infection drivers. What was it that was driving the infection? Well, there was bunk rooms, so there was sharing, sleeping, accommodation. And there was regular singing and cheering. So a lot of vocalising going on, which we know now is associated with droplet and aerosolization formation. But critically, apparently, what was not done is the opening of windows and doors and buildings were not properly ventilated, and masks were not used by campers. Now, this really is ABC now. We have been talking about this for months, that you ventilate indoor areas to reduce the viral load. Now, I know you've just understood what I've said. It's so simple. You ventilate indoor areas to reduce viral load. Everyone listening has now understood that. Why wasn't it done? And indeed, why still isn't it done in some things like retail outlets where there's still appalling levels of ventilation that I've come across recently? I'm sure you have. Ventilate the area. It's summertime now in the north. Get the fresh air in. Blow the viruses out. Reduce the viral load. Reduce the risk of transmission. Stuffy buildings with lots of people inside are going to increase the risk. You know, questions really need to be asked. Why wasn't this done? Why weren't the campers not using masks? Right, leave that there. Atlanta, public health emergency extended to mid-September. Still on the Georgia thing, obviously. World Congress Centre's opening with 60 beds. Now, that's not a lot, is it? Given that hospitals there are getting pretty full. Now, just to reinforce the problem here, this is the data we looked at. Now, this is a number of new cases. But of course, as we know, there's a delay between new cases, people needing hospitalised, and people dying. So I would expect, if we assume that the data in the United States is accurate and that the new cases are levelling off, if we assume that, and even assume that the number of new cases is going down, if we assume that, then we're still going to get this delay effect, because the people that were infected a couple of weeks ago could be going into hospital now or next week, could potentially be dying the week after, because we have this lag effect. So the number of new cases going down is only the first thing we're looking for, but we still know that they need to work through in terms of deaths and in terms of hospitalisation. Now, better news, dog diagnosis. Now, this is very good news. Dog diagnosis in the United States. Sorry, that's it. Right, now we did look at this. When did we look at this? I think we looked at this about February. We looked at this a long time ago, certainly March, I think. So the training, basically the thing is, dogs have got, the smell is hundreds of times better than ours, and or way better than ours anyway. So what they've had is dogs can sniff various diseases. So they were giving dogs these a urine with COVID-19 from an infected person to sniff. And then they were giving them other urines and other conflicting smells. And the dogs were able to sniff the urine with the COVID-19 in it again, with over 95% accuracy. I mean, that is impressive. Why don't we use dogs more and more for disease diagnosis? And given that we've known this since months ago, why hasn't more work been done globally on it? Why is there no dog diagnosis program in the United Kingdom? You know, this is such an obvious trick that we are missing. We should be training up dogs to diagnose COVID-19. But even though this program in the United States is involving 9 dogs, I know of no other in the world that I've heard of. Certainly I've never heard of one in the UK. So really, we should be training up dogs to diagnose. Now, it's been done with urine at the moment, and the trial will go on to diagnose it with sweat. So you could just let the dog sniff the person, basically, and the dog would tell you whether they had COVID-19 or not. You could then go on and test as well, of course. But absolutely brilliant. Why aren't we doing this so much more? You know, dogs are just great. There's so many things dogs can do. We could do mass screening, isolate them until the tests were proved negative or positive, and then carry on accordingly. So it seems to be working with urine at the moment. Probably will work with sweat, diagnosing people with COVID-19. Brilliant. Right, a few other countries briefly. South Africa. As we know, the official numbers of cases in South Africa, apparently the number of new cases are going down, according to South African data. This number is actually going down according to South African authorities. That's the number in the new 24-hour period. Still high, of course. This number, of course, will always be going up, as will the number of deaths, unfortunately. Now, President Cyril Ramaphosa, case fatality rate in South Africa is significantly lower than the global average, he boasts. Well, local researchers recorded a jump of nearly 60% of deaths in recent weeks. South African Medical Research Council, 6th of May to the 21st of June, noticed an excess of 22,000 natural mortalities. Increase in deaths. So, do we take the word of President Ramaphosa? I'll leave you to choose that. I know what I've decided to believe. Now, where are South Africa in the order of things? US has most cases, then Brazil, then Russia, then India, then South Africa. But of course, South Africa's got a lower population. When we looked at the per capita figures, we realised that it was actually up there in the highest ones. Infections are not expected to peak for another month. So again, this is what the South African Medical Research Council is showing. And yet, let's look at the per capita data. here we have the South Africa graph apparently going down quite steeply there. And yet, the South African Medical Research Council says cases aren't expected to peak for another month. Doesn't quite seem to add up, does it? Alcohol sales are banned again. They seem to think alcohol is a transmission driver in South Africa. So alcohol sales are actually banned, then they were allowed to be sold again. But it's banned again since last month. So that's good, because it's one potential driver that is removed if people are drunk and behaving inappropriately. State emergency is also enforced till the 15th of August. Now, this was concerning. The World Health Organization are saying that South Africa's experience was likely to be a precursor for what would happen across the rest of the African continent. So cases on the African continent have been relatively low so far, but the World Health Organization are basically saying, well, South Africa's leading the way. This is going to be the case all over Africa. And of course, healthcare provision in much of Africa is poor, despicable actually in many places. People can't get access to healthcare very often at the best of times. And with a pandemic, that's going to be way, way worse. So if the World Health Organization are right there, that's concerning. Now, we know we've had our differences with the World Health Organization, but they do have regional specialists that do know their areas. So if that's a concern for the World Health Organization, then that's a concern I'm perfectly ready to accept as genuine. Now, Germany, about 900 new cases a day for the past 7 days. Now, this just took me aback. The protests in Germany. You know, I've always associated Germany as being a disciplined country, a very correct, law-abiding country. And certainly my time there, maybe most 30 years ago now, but you get the impression of a very disciplined, very organised society. And yet 20,000 was in protests against coronavirus restrictions in Berlin. And the crowds in Berlin seem to be making a point of not wearing masks, of not observing social distancing. Like a mass insanity has broken out in Germany. This is so inconsistent with the Germany I thought I understood. Protesters talking about a day of freedom for months of coronavirus restrictions. Coronavirus false alarm. Well, I'm not go to the morgues. I'm not sure you think it was a false alarm. We are being forced to wear a muzzle. Wearing a face mask violated their rights and freedoms. Police did break up the protests, but organisers seem to take a pride in not obeying social restrictions. So this is just not the disciplined, well-organised Germany I thought I knew. I am really quite taken aback by this. Now, okay, 20,000 is a very small minority. I'm sure the vast majority of the German population are behaving well. But in the past, that would be unimaginable that you would have that in Germany. It's just, I really am quite taken aback by the German situation. And with the cases increasing, it's only going to get worse. Having done so well, it now seems to be going backwards. Russian data, say no more. It's been questioned by the WHO and the European Union. Now, the reason I'm talking about Russia today, they're starting a mass vaccination program in October, a couple of months' time. So Russian scientists all been paraded on TV. Early stage trials of a vaccine based on adenovirus, a similar virus. So it looks like they've adapted a virus from a vaccine, from adenovirus-based vaccine to a coronavirus-based vaccine. Now, of course, quite what's going on in Russia, it's hard to tell. The intelligence authorities in the UK and the United States were satisfied that Russia had been stealing their vaccine data. Pity that was necessary, because we should be sharing it, but Nevertheless, it seems that the Russians were stealing data from Western programs, and yet Russia's all of a sudden got this vaccine that's ready to rock and roll. Developed by this institute, what these scientists are saying, completed. So trials of this have been completed. The results were complete success, or trials were a success. Teachers and doctors to be vaccinated first. Now, a little bit alarming for teachers and doctors in Russia. Dr. Anthony Fauci comments on this. He hoped that Russia and China were actually testing the vaccine first. So this is getting Dr. Fauci in here. Are they actually testing this before they give it? Have there been phase 3 randomised double-blind controlled trials? Dr. Fauci is hoping that they've actually tested the vaccine first. US should have a safe and effective vaccine by the end of 2020. This is Dr. Fauci again. And I do not believe that there will be vaccines so far ahead of us that we will have to depend on other countries to get the vaccines. In other words, I think what Dr. Fauci is saying here is he simply doesn't believe that the Russians are that far ahead of the Americans in vaccine development. So I think that's all I wanted to do today. Got to limit these things. There's so much you could do. Let's hope that the discrepancies that we're already starting to see in the US data don't get any wider. The differences between the data collected by the New York Times, for example, and that published by the Centre for Disease Control start coming closer together. If they start getting further apart, then that really does make a mockery of things. And let's hope that the data from these other countries is accurate. But I'll just put that up. So these are the confirmed deaths per capita. Let's hope that these downward trajectories are accurate and that the numbers can be small until a vaccine is available.